need to window, need desktop. Okay. Bismillah ar-Rahman ar-Rahim. I would like to welcome you all, my dear vascular colleague, to a course which is a virtual duplex course. We have here on site one of my very dear colleague, very eminent vascular surgeon. We are going to have 1 hour to know how to do duplex scan, and after this lecture, 1 hour will do the duplex scan itself. I will start by mentioning a little bit about this course. This course is intended to learn vascular surgeon to learn the skills of how to do duplex scan. It's a vital skills in your career. Learn how to use duplex in your practice. With the new machine, you can put scan in your pocket. It will definitely affect your practice. How to get the basic knowledge. A lot of vascular surgeons, when they see machine with a lot of buttons, they get afraid and they get worried. And that is why we need to cut this fear in order for you to have the ability to know your machine and to be able to use it very well. Well, I'll just continue with the machine. This is called the TOT course. What TOT means, or train the trainer? This means that we are able to let you not just to know how to do duplex scan, but in the future you will be the one that will teach others to do duplex scan. So we are training the candidate here, the 4 that we have here on site and the multiple that we have online, how to teach vascular duplex scan, not just how to do duplex scan. And this is very important for the TOT course. TOT based on this Bloom's taxonomy, which means that the basic level, I will let you know how you remember the information, maybe a little bit understand the information, but I will also teach you how to apply the information, analyze the information, evaluate, and then hopefully create. So a lot of people can have duplex scan, but they don't know what they are looking at and how to look at. And this is Bloom's taxonomy. So hopefully we will be able to put you in the upper 2 category in the evaluate, create rather than remember. And this is the basic of TOT. Now the old system, we all are surgeons. We've been told when we were young that you see one, you do one, and you teach one. This is the old system. It is not right anymore. What we want in this course for you to not to see one, do one, teach one, but I want you to learn how it is being done, to practice. After 1 hour, you will do duplex scan yourself, how to deal with duplex machine, how to write the report, and how to teach others how to do duplex scan. And this is the advantage of TOT over others. Now, the teaching has changed dramatically in the last decade. Now we are having what is called the flipped classroom. That is why in the group in WhatsApp and Telegram, I did put to you what is called like homework. You need to study, and when you need to study here, you need to learn about how to do lower limb duplex scan. And we are here. We are in the meeting that we are discussing how to do it, tips and tricks, how difficult, how easy it is, how to deal with the machine. And after that, we will leave 1 week. For this 1 week, you will be able to read more, read a lot of books. Now we have a cloud that have around 1 gigabytes of vascular duplex books and vascular video. And people who are enrolled in the course will have 1 giga of information to be entertained and to have this course. So this is called the flipped classroom technique, which we will use. Obviously, this course is due to a great effort from Dr. Mahmoud Salah, from Dr. Iman, and from Dr. Muhammad Ahmed. He is the vascular ART team, which are very much enthusiastic about pushing the teaching of vascular duplex. Our resources, all the 1 GB is in cloud drive called the Rakuten drive, and this is a Japanese drive. Free of charge, you will have 1 GB of teaching material for you to help. Let us hear this video. I think it's a nice video. We all have seen it in our practice. This video explains that a young doctor, you see a patient, you want to do a duplex scan on his vein, his arteries, to do puncture, but you can't do it. It's okay. Anyway, I will put the video later on. We'll put the video later on. This video speaks about a doctor, young doctor, eager to do duplex scan to a patient, but he cannot do it. He asks for superior advice. He comes late, and then he will not help him to do duplex scan. So my aim is through the internet to let you know how to do duplex scan just over the internet without attending on site. Now, this is the course introduction. You need to understand the basic ultrasound, perform a basic arterial venous duplex scan to be able to report the duplex scan, and to be able to do duplex assisted procedure. I'm sure duplex is a vital part of the skills that you're able to grasp, because you will need it a lot in the future with duplex scans, advanced programming. You will use it in your practice. What you need to know the basics of ultrasound, which I will explain quickly. I wouldn't go much into detail. You know how to deal with the machine, duplex scan, and our 3 candidates today will be able to see a machine they haven't seen before, see the bottom and work on it, and how to interpret duplex image, and then how to report the duplex image. Now, the basic ultrasound is a form of mechanical energy transmitted through media. And there is what is called the probe. The probe that you see here is formed of a small crystal which send the signal and reflected on the tissues. This is the basic idea. And you must know that air is the enemy of ultrasound. This is the audible sound. You can see that is the industrial ultrasound is between 20 kilohertz to 1 megahertz. And this is the frequency that we are using. Now they are using a lot of higher frequency, which can be used in stopping pseudoaneurysm. So not only you diagnose the patient, but you can treat the patient as well. And here is the audible sound, what you sound in here. Now here is the propagation velocity. That is why we put gel, because the velocity of this ultrasound does not go through air. If you see here, air is the enemy of ultrasound. So you must have a good contact with the skin, and you must have plenty of gel. What is A mode? A mode was in the past just you send a signal from the probe, it comes a signal, and you get a dot. Now there is a B mode, and B mode will be used clearly where you get a reflection of this signal with the intensity, how intense it was, how bright it was. So if you get the probe like this in multiple areas, you can have a picture of an organ. This is a liver, which was done by ultrasound, and this picture was taken in 1945. You can imagine. I will show you now how you can see the liver with the new beautiful machine. But this is called B mode, which we'll be using a lot. It's called the B mode. Now, M mode is being used by cardiologists for the valve. If you want to know if there is valve incompetence or stenosis, you need M mode, and will not use M mode in our duplex course. What is the probe? The probe, as we said, is crystals which have multiple signals, receiver and sender, and you get multiple array of information. And this has been developed dramatically. Now we get really very good images. This is called the harmonic processing. You don't need to know that, but this is just a purification of the signal. Now the thing which make vascular surgeon doesn't want to do duplex is this, is nobology. When you look into machine having all this button, come on, how I'm going to do that? And this is where you break. Now this technology is coming much simpler, and each bottom have a certain purpose. So don't be worried if you see a machine with all this bottom. This is called knobology, and we will teach how to use an introducer. What is an introducer? This is kind of an art. I will show you the hockey stick introducer for digital artery, one of the very recent introducers that has been used. These are the transducer. You get the frequency and the size of the transducer. It's been quite expensive. It can go up to 300,000 Egyptian pounds. So it's very expensive to let the cord to go to the floor. And mostly does not covered by warranty if it got damaged. So it's very important when you deal with duplex machine to take care of the probe with a proper handling. So this is a duplex machine. This is where you put, don't let the wires come dangling like this. I usually put it around my body. I will show you how. And don't let these cable to be kinked like this, because this will be difficult for you to follow. Don't run, of course, because these are wheeled duplex scan. But you will see the recent duplex scan is just, it can be your mobile and it can be your iPad. It doesn't need to have all this big machine, and don't let it be crumbled like this. We are using Logic P8, which is very nice machine. There is always a button called the preset. Preset is an easy button that will give you, if you want to do arterial, preset arterial, venous, preset and venous. And this is what we're going to do today, which will be the venous. There is always important button called freeze. When you want to stop the image, write what you want on it, and then you put it in the patient report. And usually it is either right freeze or abbreviation FRZ or green color, and you will detect this button quickly. Measurement is very important to do measurement, diameter of the vessel, the peak systolic velocity, all this measurement. I will show you how it is being done. This is the transducer frequency. Again, it goes between 2 to 3 megahertz for the abdomen, lower frequency, or it goes up to a very high frequency, like for the digital arteries, up to 12 and 15 megahertz probes. This is the transducers, multiple transducer with multiple frequency. And this is the gain. If you want to improve the picture, you increase the gain. And again, I will show you the bottom to increase the gain. There is the time gain compensation bottom, which in the new machine is not found anymore, but in the old machine, they look like this. And this, when you get more gray B mode, to be more elaborate, more clear with these TGC bottoms. Now, what is a vascular lab? A vascular lab usually is a duplex machine, but you also have other tools like the segmental pressure reading, like the transcutaneous oxygen and photoplethysmography. But to be honest, the duplex scan is the main tool that you will need in your vascular practice. You not only diagnose the problem, DVT, you can actually do endovenous ablation, so it can be therapeutic. You can do treatment of pseudoaneurysm by pressure. So it is very versatile tool to vascular surgeon. And we hope that you start using the course now. Just after this lecture, you start doing duplex scan on a real patient and with the real duplex machine with this real. I will show you how it is simple to do this. These are the other modalities, the transcutaneous oxygen tension, not very common, and this is the segmental Doppler pressure reading, and this is the image for the transcutaneous pressure readings. What is new in 2024? We have better images. We can live stream the image into your mobile, so you don't need the big machines anymore. You get better diagnosis. You got something called red switch. You press on the bottom, red switch, it will enhance everything. Enhances the Doppler signal, enhance the image, and enhance the color. So it is getting much easier. There is now a lot of therapeutic use. This is the machine that was, I think, in 1940. This is the machine that we will be using today. You can see the difference, how it is dramatically easy for us to use. And this is the ultrasound technology. You don't need to go into detail of that, but all this to make it life simpler for you. And this is the development of ultrasound, how it have propagated into 3D and 4D and multiplanar acquisition. Again, you're not involved as vascular surgeon in the ultrasound technology. What you want to do is a practical application. Duplex for IVC filter. You can do duplex guided IVC filter. You don't need to take the patient to an angio suite to put an IVC filter. You just get the vein, you get the IVC, and you do the all deployment duplex guided. You can do duplex guided arterial cannulation. And now there is intervention, transradial, transulnar intervention. So you use the radial and ulnar artery of the same hand for CTO occlusion of the peripheral vessel. So this is important. Duplex guided arterial intervention, again, you can do SFA intervention with zero angiogram, totally with duplex. Duplex guided endovenous. If you book a patient for endovenous laser, you don't need to wait for a radiographer to do the duplex for you. Duplex guided catheter replacement. Now, you should be do CVP catheter, Swan-Ganz catheter, all duplex guided. You're not allowed, if you are in UK or United States, to do puncture, femoral puncture without duplex guided. It's routine. So you must use it to avoid complication. Again, duplex guided compression pseudoaneurysm. So you can see how much practical. This is a video about how to do IVC IVC deployment. I will put it on the cloud again. And here is the paper for the transabdominal duplex arterisonography for bedside IVC filter placement. So you see the use of the machine while the patient is on. And this is about recannulation, and this is a video about how to do duplex guided intervention. This is the duplex machine, and it gives you a beautiful picture with the anatomy, and even normalization peak systolic velocity is more accurate than angiogram. Okay, this is how you do the puncture, and this is the basic information that I want you to do about ultrasound. Okay, so we'll go to the second part of the course, which how to do venous duplex scan. So I will go to the second part. So the second lecture, I will teach over the next 30 minutes how my dears, Dr. Mustafa, Dr. Muhammad, and Dr. Mina, to do venous lower limb duplex scan. Okay, so it will take only 30 minutes. I will put you the basics of duplex scan. I hope my voice is reaching you all, and the picture is reaching you all. So we have a patient. We will take history from him, which is very important. The patient complained of pain in the right cuff muscle. And this pain has been there for 5 days. And he has multiple DVT on the left leg. He came to you, to your clinic, asking that he is worried that it might be a DVT. How we can help him? Lower limb venous duplex scan. It's essential vascular skills. Please, all vascular surgeons hearing me, start your duplex scan. And here in Vascular Art, we offer you a service. If you have a patient, you want to do duplex scan, bring the patient to the unit. We will have supervision. You can do the duplex scan, and you can earn money and learn on the way to do that. So this is an excellent service. After finishing the course, having your certificate, let us start your practice. And it's an open field. You can treat patients with your duplex, and you will need it in all your puncture. And it will increase your surgeon income. As a vascular surgeon, you will have fees for using duplex. It will make your life easier, and it is very easy to learn. Venous anatomy, I did put you the chapter a few days ago. So this is the venous anatomy. Very important for you to know that the superficial femoral vein is now called the femoral vein. because if you have thrombosis in the superficial femoral vein, we don't want it to be, the clinician thinks that this is superficial thrombophlebitis because this is a DVT. So now the name have it changed from superficial femoral vein into femoral vein. So you have common femoral vein, and this is the venous anatomy. Easy, doesn't take much, and you can do it. And this is from the front, and you need to know the muscles, the gastrocnemius veins and the soleus veins. Both of them are very important for cuff vein thrombosis. And also pedal arch veins is very important, especially with deep venous arterialization. So this is the anatomy. You must know the anatomy before doing duplex scan. Superficial anatomy, you must know how to get the great saphenous vein, how to know saphenofemoral junction, and how to know if it is competent or not incompetent. And you get the tributary veins, perforating veins, the communicating veins. So you need to read the chapter about the anatomy. Now this is called duplex anatomy, which I already uploaded a book about duplex anatomy. And this is, it will show you how the anatomy relation between artery and vein. This is the common femoral artery, this is the common iliac artery, and common iliac vein. And this is the superficial femoral artery, this is the deep femoral artery profunda, and this is the common femoral vein. So this is a very nice book that will tell you the duplex anatomy, and you will see it yourself. Again, duplex anatomy for normal vein, partially thrombosed vein, and totally thrombosed vein, how they look like in duplex scan. So, common indication, as I said, this patient have doubt that he might have a DVT, pain in the cuff muscle. You can get patient venous ulcer, you can get visible varicose vein, pain, edema, and this is very common indication you will see in the clinic. So we know the indication, and we are the one which actually do the referral to go for radiologist. No need to do that, but you can, on this indication, start doing duplex, which we will do over the next hour. Contraindication and limitation. Really, some people say obesity. I don't think really you can do with a lot of obese patients. If you have an open ulcer, again, you can clean the ulcer, put opsite, and still can do duplex. Severe edema, not really contraindication, but you might say this is a relative contraindication. But you can do duplex scan to 99% of your patients. Now, duplex guidelines. It's very important for you to introduce yourself to the patient. You must explain the examination. I am Dr. Fulan. I will do over the next 20 minutes a scan for your leg. It wouldn't be painful, and I want to get the information, and it wouldn't hurt you. This is very important. Again, if this patient was referred from someone else, don't be involved in the treatment option. And this is very important because usually the patient tell you, what is my treatment, doctor? If this was referred from someone else, I wouldn't tell him you need endovenous laser or endovenous radiofrequency. I will leave decision to the clinician. But if he's your patient, you are allowed to tell him, I think a better treatment is this. So number one, introduce yourself and take history. Number two, you do a quick assessment to the patient. You see if he is having dyspnea, he's having heart failure, he's unable to sit down, and so on. Number three is duplex position. You can do it either standing or sitting. The main idea is to do reverse Trendelenburg to get the veins being filled while you are doing duplex machine. You can do it standing if the patient doesn't bother, but some people, for example, after cesarean section, unable to stand up, or someone with severe osteoarthritis, he cannot stand up. So you can do standing if possible. Supine, reverse Trendelenburg, and you usually put the knee flexion and a slight external rotation. This is the optimal position to do the venous duplex scan. Number four, venous technique. You must use two probes, linear probe and abdominal probe. Linear probe from groin down, and use a transverse plane to do compression, and you can use longitudinal plane. And we will show this on the patient over the next session. Now, vein compression every 1 centimeter, sometimes every 2 centimeters, not necessarily one. By vein compression, you can exclude thrombosis. You have linear transducer, and you have the transverse section and longitudinal section that you can use. The abdominal probe, which is between 2 to 3 megahertz, we will show you in this machine, is used for the common iliac vein and to show if there's any thrombosis or IVC, inferior vena cava. And you must detect if there is thrombosis or not. Now, what I want you to know from any vein is to do transverse section, longitudinal section using B mode. And this is to see if the vein have a thrombus or not. Then you see the Doppler signal in the vein by longitudinal section. And then you do a compression test. So this is what you need to do to every segment. Now, for every vein, this is the information you ask yourself. Is this vein patent or is it occluded? What is the diameter? Is it giant or is it small? Is it refluxing or not? And what is the wall abnormality? Does it have a previous changes from previous DVT? What is the Doppler waveform and the thrombus? So this is the voice okay? Yeah, okay. So, and the thrombus exists. So this is the information, number 6, that you want to know. So I will ask Dr. Mustafa, Dr. Muhammad, what do you think of this vein? Is it patent? And this is the first time they will do Duplex, but I know from their skills, they will get a very good information. Now, there are 2 schemes to do Duplex scan to vein, either groin to ankle protocol, which you start from the groin, and then common femoral vein, you go superficial femoral vein, then great saphenous vein thigh, then thigh perforator, great saphenous vein leg. It's 19 vein, and I enumerated him, and all this lecture is also found in the course, so you don't need to write it down. It is being uploaded in the cloud. So this is the 19 places that you need to check with Duplex scan. So you can imagine if you take 1 minute every vein, you need 19 minutes to finish all of them. Some people will do ankle to groin protocol, and it is recognized, and some people do it. So they start at the ankle. So you have the choice. I prefer, or my recommendation, do groin to ankle protocol, and after you finish the ankle, go to common iliac, external iliac, and IVC at the end. But this is the same 19 places, but on the other way around, which is called ankle to groin protocol. Now, Doppler finding, sometimes you can see normal variation, normal velocities that we are going to see. Sometimes you see abnormal waveform. Sometimes you see thrombosis. You see multiple things that you can report on. But these are the basic things that I want you to show. I wanted also to show you how you can use artificial intelligence during your work. So if we shift to artificial intelligence, hope we can share desktop. Okay. So this is artificial intelligence. Now, artificial intelligence very helpful for you while you are studying and while you are working for Venus. Let us, for example, say, what are the best books to read in learning vascular duplex ultrasound from recent courses? I've put this question to Gemini, and Gemini is the preferred artificial intelligence platform by Google. I recommend you to use it for medicine and for vascular surgery. And you can see this is the recent, which is called Gemini Advanced. Very few computers have this. Again, #1, Rutherford textbook. It have a good chapter about duplex scan, ultrasound, understanding vascular ultrasound by Stephen Gaffith. This is book which is on Amazon. Very nice book. General and vascular ultrasound case, and you see the answer. It will give you the best books right away within few seconds. I've uploaded 10 vascular duplex books for you to learn from, and this is how you can use it. Here is also important to question, how much time do I need as a vascular surgeon to learn about duplex scan from reliable sources? You can see Gemini have all the medical knowledge. So when I say from reliable sources, I constrain him to evidence-based medicine. So here he mentions that a lot of factors affecting this. What is your previous knowledge? Because we are vascular surgeons, we have very good knowledge about veins. Usually, it's not accurate to give you exact time, but you will say that you need to have the basic knowledge, sometime advanced knowledge, and this will take time. So my recommendation to go to structure training. But there is a lot of literature that you can teach a vascular surgeon to do duplex scan within 1 week. In 1 week, you will be able to do the basic fundamental of duplex scan. So duplex, again, is very helpful. When you want to study, let us say, create an MCQ question on vascular duplex scan and mention the correct answer. If you want to study, you can tell him create MCQ question, and from its bank, you can see it in front of the eyes. Here is the question: patient presented with symptom lower limb claudication, perform duplex ultrasound. What is the answer? And you can see the correct answer will bring it to you. So if you want to study, you can study using artificial intelligence. It helps you a lot of vascular duplex scan. And I have a lecture about robotic vascular duplex machine, which again very helpful. I wanted to show you that artificial intelligence is a helpful tool. So I wouldn't go much. I think I've took now roughly 30 minutes, which is good because I wanted the workshop to be more on actual working on the patient. I wanted to show you that you don't need much preparation before doing duplex. Don't get afraid of the machine. So we are going after 5 minutes to bring the patient to run the duplex machine and to take it from there. We are very much open to question. If you want to put a question on the chat, we're using Google Meet, which doesn't have any lifetime frame. So if you have any question, please put the question. And I can see Professor Mahmoud Salah is watching us from Saudi Arabia. We're delighted to have you, Professor Mahmoud Salah. We'll hope to encourage a lot of young vascular surgeons to learn how to do duplex scan. And the mic to you, I hope you can speak to all the vascular colleagues.
Thank you very much, Dr. Muhammad, for this very nice talk. First, I would like to welcome all our attendees, whether physical or those attending online. Let me just introduce the idea of vascular art. Vascular art is not a center that we are competing with other centers. Actually, the principle is to cooperate and not to compete. So you will find it a little bit strange center that than you are used to see. Okay. Number two, that we feel responsibility not only for our patients but for our doctors. That's why you are all invited here for our first course. Third, that we're lucky to have Dr. Muhammad Omar Al Farouk as our TOT director. He is having this passion of teaching, and by the way, I am older than Dr. Muhammad Omar Farouk, and I'm practicing vascular surgery before him, but I am learning from him. I am learning from him, and I'm enjoying talking to him and discussing any case with him. So you are lucky to have him. Final that I challenge that you will find any center in the world will invite you to please bring your patient here and use our venous duplex on your patient, and use our consultant as supervision, and get your money. Nobody on earth will tell you this. Either you refer the patient to us and we'll do the duplex, we'll give you the result, we'll take the money, or you can take the patient and do it anywhere else. Nobody will give you the offer that you heard from Dr. Muhammad Omar Al Farouk. So I am very happy. I don't want to take much time from your course, and I'm happy that I'm attending this course. This is our first course here. Hopefully, inshallah, will be followed by many courses. And by the way, we are open to any idea. If anybody would like to suggest special course, we can arrange this. And finally, you are all welcome to Vascular Art Center anytime. Thank you very much, Dr. Thank you.
Thank you very much, my dearest Professor Mahmoud Salah. I always learn from you a lot. I've never forget your presentation about reimplantation of the upper limb of patients in Saudi Arabia, that you've done 3 cases, which was amazing. And your bilateral carotid body tumor, the heroic operation that you have done, which was fantastic. And I learned a lot from you. I can't learn from your courage and your honesty, and we all owe you a lot, really, Professor Mahmoud. And I'm hoping to have a course to pass MRCS exam, inshallah, to help our candidate to do that, because we have around 2,000 go for MRCS Part B, and the failure rate is very high. And hopefully we'll do another course, how to learn artificial intelligence, because artificial intelligence is not going to take our job, but vascular surgeon who does not use artificial intelligence are the one which will be out of business. So I'm giving course for artificial intelligence using Python coding, and to have programming to detect COVID on a chest X-ray, and to detect endoleak on CT angiogram. I'm also going to have multiple courses with the new tools like the 3D skin printing that you have done multiple cases, I believe, and we hope to benefit from your experience.
Thank you very much, Dr. Muhammad. Again, wallahi, you are very generous, giving all your science, your experience, your information to the others. And I will be glad to participate in the any course, especially this for the Part B MRCS. You know, I'm also examiner in the Royal College of Surgeons, so I know exactly why our candidates fail in the Part B. So I'll be happy to assist and to help. Also, as I said, I know that many of our candidates, they are not very professional in reading the CT angio or the MR angio, so we can even put this into consideration if you'd like to arrange something like that. You are the boss for the TOT, and thank you very much.
Okay. Thank you very much, Professor Mahmoud Salah. And let me start. After 5 minutes, we're going to get a patient. You can have a nice cup of tea and a nice bit of refreshing before we go to the practical part of the workshop, how a vascular surgeon have not done a duplex scan before will do it exquisitely good with supervision over the few cases, and then we'll get certificate, and then we'll start their practice with the vascular duplex scan. So see you all after 5 minutes of refreshment. Bismillah ar-Rahman ar-Rahim. I'm honored and delighted that Professor Mustafa Suleiman is with us here.